Justice for Mohbad. No justice, no peace. My people, another shocking update from a US licensed nurse wey be say e don show interest for the autopsy and the toxicology report wey our Nigerian government, our Lagos state government, when they let us know say see wetin kpai Mohbad, say it might possibly be a result of drugs. This our American nurse don come out to come let us know say much investigation need to be carried out because according to her say the FM hydromi say na antel allergies. Say for instance, if somebody is having an allergic reaction, you can give that person the FM hydromi up to 50 milligram. Please, I'm not in the medical field. In case I not pronounce this medication well, I go still play the video make una hear. Say this drugs is very drowsy and it causes sleeplessness. The only time that you can administer these drugs, the only time you can use this DFM hydromi on a patient, which you must administer about 100 milligram, is like in a psychiatric place, in a psychiatric hospital, like when that person is very, very agitated, when that person is very aggressive, you want to calm that person down. That is the only time you can even use these drugs. So, for the lab, when he carry out that autopsy result to say that they found some grams of this medication, this DFM hydromi in Mohbad's liver, then it shows that Mohbad was poisoned. Yes. Meanwhile, it doesn't even comes in grams, it comes in milligram. For those of una wey dey into medical field, una be doctors, nurses, una go know the difference between grams and milligrams. Just like centimeter and meter, there is a big difference. For the lab to say they found something like that, the Ephraim hydromi for inside Mohbad liver, then they might have poisoned Mohbad with that drugs. For them to find grams for inside Mohbad body, inside liver, not milligram, grams, then there is something fishy. That nurse, that auxiliary nurse that administered that medication on Mohbad, that gave Mohbad that injection, should be brought to book. This matter don comot from Nigeria. Na US nurse, a licensed one at that, na im dey talk now say Nigerians should not just let this matter slide. This report from lab, they should go for more, dig more into it, because Wummi called that nurse on that very day. Wummi know what to say. For Wummi to be hiding the truth about what by her husband, then Wummi is a #1 suspect, because somebody cannot just come and buy your husband, a nurse. According to report from medical experts, now that injection when the auxiliary nurse administer to your husband na kpai, you never hold that nurse responsible say make she can't tell you wetin she put for your husband body. Instead, you are hiding from the truth. You don't want to say anything regarding your husband's kpai, as if you were not with him. Even before the last seconds of his life, you were with him. So Wummi, you should be able to tell Nigerians, the world, the Aloba family, what was that medication for? Why did that? According to this, I go drop the full audio make una hear, because this nurse analyzed a lot of drugs they found on Mohbad. Drugs no mean say person they take substance. Drugs can be medically inserted into your body. It can be reactions from excess or too much of medication. It still be drugs. So it's not because they say na drugs, not me say Mohbad was taking some, substance. So this American nurse, my people, I go like make all of us sit down, watch this video together, because this is the best analysis when it comes to this result, this autopsy result, when they just bring out few days ago. She really tell us what to do and what we should be expecting, who to suspect, why there were so many things, many medications detected in Mohbad's body. That's why even after the burial Wummi body, Mohbad was still very fresh. Anyway, guys, let's watch this video together. This na Legalized TV. Hit on the follow button, subscribe to my YouTube channel, and remember to put up the post notification bell. Now, wow, come see say they find these drugs when e be say na only patient wey dey psychiatric na dem fit dey use am until they calm. This DFM hydromen for inside Mohbad body and many other more medicine wey this nurse talk. Guys, na go know say something is really fishy. They use those drugs poison Mohbad to kpai. Ha! May his gentle soul rest in peace. Guys, let's dive into the video.
Diphenhydramine is an antihistamine, and it's also an anti-allergist. For instance, if somebody is having an allergic reaction, you can give that person diphenhydramine up to 50 milligrams. It's very drowsy. It causes sleepiness. The only time we use diphenhydramine in high doses of 100 milligrams is like in psychiatry, when somebody is very agitated. So you want to calm that person down. And sometimes you also use it for when you want to like counter some other medications, which the list is going to be too much for me to mention here. So for the lab to say they found grams of diphenhydramine in the liver, it shows it was poison, because there's no way, it doesn't come in grams, it comes in milligrams, and we all know the difference between milligrams and grams. Milligrams are very tiny. It's just like centimeter, and in the medication side is when it say milligrams, it's very minute. So when somebody's system, if they found grams of diphenhydramine, it means it was injected on purpose to kill that individual. That is one. Then I take you guys back to the initial presentation by the police when Mohbad died, that they found the initial findings. They found a tetanus toxoid, they found the midazolam, and then they found rocephin. The midazolam, otherwise known as Versed, is only used in the operating room, in the OR, where they use it to put the patient to sleep before the anesthesia. So when they found that, that was the initial time I started thinking there's something more to this. Who gave them midazolam? No pharmacy dispenses it. It's not a prescription drug. It has been taken out of the market for a long time. And the metabolism of midazolam is rapid. It goes straight. So if Mohbad has been given that medication to paralyze him, of course he can't fight the intruders. That one alone will kill him. They didn't mention the grams or milligrams of midazolam they found in his system, but finding grams of diphenhydramine in an individual, that is poison.
Exactly.
It's toxicity. So that alone could kill him because it will depress his respiration. So what they did to him was respiratory depression. They depressed his respiration.
This is exactly what killed the boy. Exactly.
So that he cannot breathe.
This is just the thing. This is...
I'm surprised at what Nigerian doctors are doing. They should be able to bring up all these findings, the little findings from what was found in this boy. So even this lab,
Question, real quick.
yeah.
You are a nurse. You are a nurse, or what's your profession? Just so everybody knows.
Okay, I'm a nurse practitioner and a clinical specialist.
Thank you. Thank you.
So,
Thank you so much. Rhino, that is addressed to you. Attention, who needs to look at it? Who needs to take action on it is this particular person. Here, they just have to M30285, ITSI Biosciences LLC, 633 Napoleon Street. It's no attention to anybody.
You don't cuss.
Look at it here. This one, attention, they will give example. You have to have somebody's name. Or, you know, a particular department where this needs to go to.
Counterfeit.